Thank you for joining us for the fourth annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the key to accelerating innovation, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is Dr. Janice Lee. As a nephrologist, I am honored to serve on AAKP's Board of Directors and Executive Committee, alongside many kidney patients and care partners. I am currently a professor of medicine at Emory University in Atlanta, Georgia. I'm board certified in nephrology and hypertension. I also have the pleasure of serving as the clinical director of nephrology and of telenephrology and the chief medical director of Emory Dialysis, which serves over 750 patients. I'm proud to have been designated as a master clinician at Emory Healthcare and serve as the chief of staff at Emory University Midtown Hospital. More recently, it was an honor for me to be appointed to the nephrology board of the American Board of Internal Medicine. As a nephrologist, my research has focused in hypertension, chronic kidney disease, dialysis, and health disparities. It's been very exciting and rewarding for me to be a part of AAKP. It's actually been the most rewarding experience I've had throughout my medical career. I enjoy the patient advocacy, being involved in several initiatives to improve outcomes in kidney disease patients. AAKP is truly a patient centered organization. I've had the pleasure and opportunity to participate in several activities, such as being a senior advisor to policy, research, and clinical trial activities in conjunction with several federal agencies. I've been very involved in giving webinars and speaking on different issues that are relevant to kidney patients, um, mostly around home dialysis and increasing utilization, talking about the healthcare disparities that exist around home dialysis and transplant. Also focused on the COVID pandemic and very timely information for patients to help navigate during that very difficult time. I also spoke regarding how to use telemedicine so that patients could continue to be connected to their healthcare providers throughout the pandemic. And whether you are a healthcare professional or patient as an AAKP member, you can do the same. It is critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. Through AAKP Global, launched in 2019, AAKP is engaged internationally because we are committed to educating patients and leaders across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe care treatments. Globally, we are working with patients, medical professionals, researchers, and medical industry allies to cultivate a united consortium led by patients. AAKP believes this international consortium can advance innovation and change kidney care in countries where healthcare systems and/or infrastructure do not support patient consumer choice and/or access to care or treatments. For our panel session on a global drive for innovation in home dialysis, industry responds to growing demand for home therapies. I am now pleased to introduce AAKP ally and friend, Ms. Leslie Trigg. Leslie is CEO of Outset Medical, and we are happy to have her join us today to share Outset Medical's commitment to advancing home dialysis. Leslie, I turn it over to you.
Hi, thanks so much for having me. And I just wanted to thank the AAKP and GW University for this invitation. It's a real absolute passion topic for me. So I'm just thrilled to be here and share a little bit about Outset's experience. I think involving, I'll say, the patient consumer is both strategic and impactful. I can't imagine really doing it any other way. And in trying to make the case for that point, I thought I'd provide some examples from our own experience here at Outset to illustrate why it's so vital to design with patient consumers, not just for patient consumers. Before I do that, maybe I'll take a quick step back and tell you all just a little bit about who we are and what we're focused on doing for context. So Outset Medical is a medical device company based here in San Jose, California. We're a publicly traded company. We have about 700 employees across the country and south of the border in Mexico. The device that we've designed and that we manufacture is called the Tablo hemodialysis system, and it has FDA clearance for use in hospitals, clinics, and also for home dialysis. There are several thousand Tablo consoles in use at hundreds of facilities across the country. You can see a few of them down below. We're a relatively young company. Our first full commercial year making the device commercially available here in the US was just in 2019. So we're entering just our fourth year of commercialization. We've learned a lot along the way. Some of it I hope to share with you today for your benefit. So beyond the what do we do and where are we based is something much more important, and that's what we believe in here at Outset. What we believe in is serving as a catalyst to transform permanent and profound change in where, when, and how dialysis is delivered for one reason and one reason only: to restore identity and agency and self-worth to patient consumers worldwide. This is our why. This why has not changed since the founding of the company in late 2010. And it serves as the basis, the backbone, the foundation for all of the decisions that we make and the paths we choose to take and those. So this is the what we designed with that why in mind. The device right behind me, that's me on the left, and one of the patients at home who's using Tablo. So that is the product incarnation and the product of 8 years of development work, not for the patient consumer, but with the patient consumer. And I want to talk a little bit about all the ways in which we collaborated with the patient consumer, the caregivers, the family members, etc. So our fundamental philosophy is of the consumer versus for the consumer. I think that designing for the patient is very different than a mindset that the end product is for the consumer. Designing for the patient or for any consumer often leads you, in my experience at least, to talk with people who know the consumer but aren't the consumer. So for example, in the beginning, and I'm going way back in time, 2012, 2013, 2014, we talked to a lot of nurses, we talked to a lot of techs. They all know the consumer really very well. But in this case, for home dialysis, they're not the consumer. They're not going to be the user. And so here are some of the things that we heard. We heard you definitely should make Tablo white. Okay, why? Well, because all dialysis machines are white. Don't make it blue. Nobody liked the color of Tableau, who knew the consumer very well. Those users, the healthcare professionals, said you have to make it taller. Nobody would want a dialysis system that is as short as it is, that's as petite as it is. Why? Well, because everybody likes to stand. Oh, healthcare professionals stand in clinics, but we believed as consumers, not a lot of us spend a ton of time standing in our homes. So when we finally talked with consumers and oriented our mindset around product design that is of the consumer, it made a really big difference. The system remained blue. The system remained 36 inches tall. And perhaps the biggest design change that was influenced with our consumer was the door. We got feedback early on from healthcare professionals that you absolutely cannot put a door. Do not do the door on Tableau. Why? Well, because everybody wants to see the blood circulating around the blood pump and through the dialyzer. Then when we talked to consumers who would actually be using it in the home, we heard something very, very different, that the design of past dialysis machines was considered very intimidating. It was scary to see your own blood circulating out of your body and through machinery. And so we got a very different opinion, which was, hey, a door would really be nice if I was dialyzing at home with my kids or with other family members or friends. I wouldn't want them to feel scared or intimidated and not want to be with me while I was dialyzing. So we kept the door. And so fundamentally, I think the lesson for me was, if you're going to design something that is of the consumer, be with your consumer versus designing for your consumer. And the number one thing we heard from the consumer patient was, don't hospitalize the home. I don't want something in my home that effectively is living with me like a family member that feels more like it belongs in a hospital. So I'll give you one final example. We studiously avoided a hospital pole. Really did not want to incorporate a hospital pole, but we had to hang saline. Well, we heard from our patient consumer that they didn't want to hospitalize the home. And so that really pushed our engineers to come up with a more creative solution for hanging saline vertically. Well, it turns out that they came up with a top lid design, and you can hang saline just as vertically from a top lid as you can from a hospital pole. And it also served the function of making Tableau even smaller and less assuming in the home when it was not in use. So those are some of the lessons that we learned about product design. Now, we also really revolved so many other elements of our journey from inception on a piece of paper to commercialization 10 years later. And every step along the way, some of those critical steps were clinical trials, human factors testing, and then much later for us, policy and advocacy. So here's an example of what I mean by how much of an impact your consumer, in this case, the patient consumer, can have on your design. This is what the system looked like really as early as 2012. It had that, I'll call it kind of the open face sandwich. There was tubes everywhere. We put this in front of some patient consumers, and I'm just laughing about it again, thinking about it. I mean, it was a disaster. Like this, you know, people's look on their face was like, this has a face even a mother can't love. And they were right. Now, this original design did serve a purpose, and that purpose was for a different consumer, our engineers, when they needed a TV tray to eat lunch on during meetings. But you actually can see some of the roots of the design in this photo on the left. And yes, we did design in cardboard. That is a cardboard door. We didn't have a lot of money. And the handle on the back, of course, we heard from a lot of our patient consumers that mobility was going to be important. That handle was ripped off of an old suitcase and duct tape. You can't see the duct tape to the back. So you can really see the roots of some of the early patient consumer feedback. And there's that top lid, by the way, on which the barbecue plate is held, which ultimately led to the contemporaneous design released in very late 2018 on the right, all due to the influence of the patient consumer. In our case, we had to and wanted to seek a tremendous amount of feedback from our patient consumers and family members and caregivers on the screen. We have what's called a graphic user interface, a fancy word for a touch screen. And here the lesson is sometimes you think you're right. Sometimes you start thinking that you're the consumer when you talk to a lot of patient consumers. And there is a great fallacy in that. And I am evidence number one of this on the left-hand side. I thought the screen on the left was super cool. Everybody was going to love it. And everybody hated it. This was an early design to try to show patients how much time they had left in treatment. So in this example, this constellation of the deer, well, about halfway done, there's maybe a third more of the dots that need to be connected in the constellation so that somebody wouldn't have to be reading time or a small number on the screen. Well, what, again, we found out by going to our patient consumers is that I was actually the only person who liked this, the non-patient consumer. So I think that's another lesson. It's really important to remember. It's very easy in a medical device company when you start spending a lot of time with your patient users, you start to trick yourself that you understand their mindset when you don't. You're not living their life. So that was another very, very important lesson that I had to learn over and over again. We went with something originally on the right and have since evolved that now to custom animation and 3D video, as we heard that feedback later on in the years from patient consumers who wanted to be able to see motion for each of the 10 steps. Human factors in clinical trials, it's another just vital arena of input and impactful and very strategic input that you must get from patients and caregivers or healthcare professionals, whoever your user might be. This is a very standard depiction of what is human factors, the hierarchy, sort of like Maslow's hierarchy of needs, except in the human factors world. You start with in the device, is it safe? Is the device effective? Is the device usable? Do your patient consumers or caregivers have a preference for it? And then lastly, can you develop emotion around the device or the product? And this is our goal. Our goal at Outset has always been, of course, to ensure minimum viable product, which is safety and efficacy. But is it easy? Is it not intimidating? Does it make the person feel good about themselves? This is where those elements that I mentioned a couple minutes ago, a sense of self-worth, a sense of identity. I'm somebody who can manage this chronic condition just as well as anybody else can. I've mastered this. This is one of the reasons we stuck with the size of Tableau at about hip height, 3 feet high, because I felt that there should be a physical mastery. Most of us are taller than 3 feet. And I think if you approach a product in life that's sort of taller or bigger or towering over you, you don't feel a sense of control and strength. You might feel shrunken and a little bit intimidated that it's controlling you. And so that was one of the reasons why ultimately we went with such a small size, and our engineers hated me for it. I wanted the user to feel instant physical mastery even before they started learning it. So this is how we think about the human factors stack, if you will. Now, this may be interesting to some of you. The FDA has set a materially higher and higher and higher bar for human factors validation testing, and rightly so, particularly with devices that are going into the home. This is a photo from one of our most recent human factors studies. We've done many of them over the last 4 or 5 years. This latest one, just to give you a sense of the depth, and again, how central the patient, consumer, and the caregivers are. In this case, it's a patient and the caregiver. We tested 12,765 different tasks with patients, with caregivers, and with healthcare professionals across 2 different studies. The ultimate report was 786 pages in duration. We had almost 50 participants, and we partnered with 6 human factors experts across the country. We could not do it without the active partnership of both patients and their caregivers. An amazing amount of incredibly rich data and input comes out of this. You can see on the right, and I just took screenshots from things that are in our system called Jira, where we log all of the suggestions and improvement ideas and issues with Tableau. You can see, you probably can't read a lot of this, but tons and tons of, every bullet is a suggestion, tons of ideas that are coming directly from patients and their caregivers. Just on the left, where this was again from an internal meeting, the things that rose kind of to the top and were said most consistently. So you can really see, I mean, I love this slide as an illustration of just how powerful the connection is when you try to make something of the consumer, and what a huge impact that really can have on device, not only initial design, but iterative improvement over time, if you're listening and if you're taking action on it. The last category I thought I'd talk a little bit about is how amazingly critical and powerful is the voice of the patient, consumer, and family members in policy and in advocacy. Just to illustrate it again from the Outset perspective, we see patients and family members actively responding to CMS proposed rule elements with comment letters. We know those letters are read inside of CMS. We had our own example of that. There was a new technology add-on payment that we had applied for 2 years back. And there were dozens and dozens and dozens of patients and family members who chose to take the time to write to CMS and advocate that Tableau be awarded this new technology add-on payment rate, and it was. And so we have seen firsthand the ability of patients and family members to actively influence policy because it's a lived experience for them. And there's nothing more powerful than a lived experience. Again, whether that's through letter writing or coalitions. There's one right now called Innovate Kidney Care that has a number of patient membership groups that are a part of that, driving change in regulation to make home dialysis more available and accessible, to congressional testimony and Hill visits. That's all very, very central and vital, that we make sure that we are hearing the voices of those who are managing this disease every day. So I want to leave you with our philosophy, our strong philosophy, and our doctrine, I suppose, better said, which is product design and product improvement that, to borrow from Abraham Lincoln, is of the people, by the people, and for the people. And never straying from that conviction that good enough is never enough, great enough is good until you can get the next round of input around how to make it even better. And if there is one thing that defines our experience, it is the power of the patient consumer voice and the family members around them supporting their care over time. So I just want to thank you again, AAKP and GW, for the opportunity to share a little bit about our philosophy and our lived experience here on the device side.
Thank you, Leslie, for a great presentation and for sharing your time and experiences with us.